is Africa CDC?
Africa CDC is an autonomous health institution of the African Union. It is specialized in prevention and control of diseases. And currently, the core work that we are doing is response to disease threats and health emergencies on the continent. So it's really a health institute. Came about in June of 2021 and is designed to do four things. The first is purchase of vaccines for COVID-19 to cover 65 million Africans. So to have these vaccines get into the population through vaccination campaigns. The third is to set the stage for local manufacturing of the continent of Africa. And the fourth,
The country of Zambia which undertake that. Maybe any other country that has wished to support that.
so the whole principle behind vaccination of COVID-19 within the population, when you attain 70%, it does not mean that you're completely safe. It simply means that you have reduced the risks to a level that can be able to allow for socio-economic activities to continue. What we are doing as Africa CDC is based on a country's priorities. COVID-19 are clear to us and to the countries on the continent that we must change the way in which we handle our health emergencies. The rest of the world, particularly the global north, are currently in the market, are not manufactured on the continent. In fact, Africa manufactures only 1% of the vaccines that we consume. 99% of the vaccines we consume here in Africa are imported. So it means that we are still very far. It's been confirmed in the laboratory to be working. It has been tested in animal models and found to be working. And it has been confirmed to be safe for human consumption. So, of implementing the new public health order. At the continental level, we have established Africa CDC, we have established the Africa Medicines Agency, and both these agencies are in the process of being strengthened to be able to do more. So on the first pillar, we are doing very well. On the second pillar of training and building the capacities of our health workers, we still need more work here because there are very many different experts and professionals that contribute towards public health prevention, preparedness, and response. What we are doing now is we have various capacity building initiatives. We are training laboratory scientists, epidemiologists, clinical staff, lawyers, engineers, all to contribute to public health on the continent. As we train them, we also have something we call the Africa Volunteer Health Corps. This is a standby force of health workers. If there is an outbreak in a particular country and they don't have the capacity, then we bring in the Africa Volunteers Health Corps. We pick the necessary experts and they are sent to that particular country. They support the government there, they build the capacity locally, and when they leave, there is local capacity at country level. So on the second pillar, we are also doing quite well because we've built a lot of capacity during this pandemic. The third pillar was about manufacturing, which we've talked about. We still are not where we'd like to be, but plans are underway, and with the support from the MasterCard Foundation, we are actually right now training immunologists, vaccinologists, and technical staff who can be able to work in factories.
Just there, Doc, are you able to give us an abstract overview of what obstacles that have led to not having or attaining that everywhere manufacturing industry? Okay. What are some of the obstacles that you've encountered? How do you expect, how do you wish to overcome them?
So the first big obstacle is the lack of infrastructure on the continent for vaccines manufacturing. To be able to manufacture vaccines, you need factories that have been designed specifically to manufacture vaccines, and they are quite complex in nature. We don't have enough of those. We only have a few.
Okay.
The second big barrier is before you manufacture a product, you must either own the original intellectual property, or you must get a license from whoever owns that particular original intellectual property for the product that you need to manufacture. Africa has not been doing a lot of research and development in the vaccines space. So the vast majority of vaccines that can be able to be produced today, the intellectual property, the ownership of those molecules belong to someone else. So we have to negotiate with those who own those molecules and the intellectual property rights, so that they are made available to our manufacturers on the continent. We are addressing that by supporting research and development, so that we can be able to have our own molecules that we've developed from the beginning. The third very key barrier to ascertaining good manufacturing practice is regulatory authorities. You cannot manufacture unless you have an agency within the country that is doing regulation. So these are the food and drug agencies or the national regulatory authorities. We have them on the continent in each and every country, but their level of maturity and the vigor with which they actually regulate health products on within the country, they are different levels. And we are strengthening them so that when they reach good maturity level, then they can be able to supervise the manufacturing of human vaccines.
In Africa, the youth constitute over 60% of the population. How has Africa CDC done its own to ensure that this number of youths, because they're the future leaders and injected in every sector of running the African economy, being able to get vaccinated? How has Africa CDC ensure that these 60% of the youth are going to age fully vaccinated?
So two things that we've done that are very important in this regard. First is we've established the Bingwa initiative. Bingwa is the Swahili word for champion. The Bingwa initiative targets the youth. It is a youth movement for COVID-19 vaccination. And when we recruit young people to be Bingwas, to be champions for COVID-19 vaccination, we train them and then deploy them into their own communities so that they can be able to encourage the youth to be part and parcel of vaccination. There's a lot of misinformation out there. And because we know that youth can be able to speak to each other in the correct language, we are deploying youth to be able to go and engage with their peers at country level. So the Bingwa initiative is a very important initiative for us to be able to reach the youth. The second thing that we've done as Africa CDC is when we are supporting mass vaccination at country level, we make sure that there is a portion of that work that goes to institutions where the youth normally are, particularly training institutions and schools. In this way, we then are able to reach the youth directly and ensure that they are getting vaccinated. The numbers are quite good, and that is why you see, for example, in Zambia, when you reach 70% vaccination rate, and the youth are over 60% of the population, it tells you that the strategies are working, because we are able to reach the youth and we are able to reach the adults to be able to attain these high levels of vaccination. So these are two very important things that we are doing to make sure that we are reaching the youth and they are getting vaccinated.
They say information is power, and the COVID-19, from its inception, when it came, it really swept the world, and it was received in mixed way. So how has Africa CDC ensured that the correct information about the vaccine, about the COVID-19 itself, has reached the public? Did you find any barriers, and what were your successes?
Well, the barriers are social media has a lot of material that is incorrect and a lot of material that is disinformation, does not give you the right information. So at Africa CDC, there are a few steps that we've taken. Right at the beginning of this pandemic, we established a rumor tracking system for the continent, where we track all the rumors on all the social media platforms, and seeing where that misinformation is coming from, we support each and every country where we found the misinformation being circulated, so that they can go to build correct information and feedback to the public. So the rumor tracking system is still running to date, and has been a very good backbone for the kind of work that we are doing, the kind of messages that we are designing, and the kind of support that we are providing to our member states. Second is we are building the capacity at country level of journalists, influencers, and policymakers, so that they're able to project the right message from the word go. We shouldn't have to wait to track rumors and then we respond. We are also proactively ensuring that there is a group of individuals that have the right information and continue to engage with members of the public to provide that information. So there are two very important things that we are doing in addressing the issue of misinformation in the media.
Dr. Matt, tell us what are aspects what would you like to share with viewers out there?
Three things that I would like to share today. One is that COVID is still here with us. The numbers are low compared to last year, but the virus is still infecting people, and it is still causing significant harm, especially to those who have not been vaccinated. So let us go out and get our vaccination against COVID-19, so that we protect ourselves and those who are around us. This is the first message. The second message is it is extremely important that we get our information from the right sources, and not just for COVID, but also for public health in general. Our ministries of health and institutions like ourselves, Africa CDC, WHO, UNICEF, are good sources for the right information. And my encouragement to members of the public is when they come across information that doesn't look clear, then they go to the right source and they're able to then get that information. Third is to the youth. There is a misconception that COVID only affects older people negatively. By and large, older people who are weaker with immunity may suffer more, but the youth are not spared. And I am encouraging the youth, go out and get vaccinated so that you protect yourself, not just from COVID, because we have something called long COVID, which even after you have recovered from COVID, it is still affecting a lot of your organs, and your lifestyle becomes very, very constrained as a result of the effect of COVID. So as young people, go out, get vaccinated, protect yourself.
Thank you very much, Dr. Omah, for coming to this exclusive interview with CIC and other viewers that are watching us. You heard it for yourself, three things that Dr. Omah, the director of Africa CDC, has said. COVID is still around, get vaccinated, get the right information. Thank you very much, sir.